welcome to Aviation United by AviationZorro. I'm delighted to be chatting with board-certified urologist, still actively practicing in a Midwest Urology group in the US. Every day he is helping men in diagnosing and managing their prostate issues, including but not limited to robotic. You have to help me with this one. Prostatectomy. Did I say it right?
Yeah, prostatectomy. You did good.
There we go. For men with prostate cancer. He is also the founder and host of the Prostate Health Podcast. With the podcast, he is helping men and those who care for them better educate themselves regarding prostate health, the conditions that affect the prostate, and the latest technology in managing these conditions. On a weekly basis, he is chatting with experts, innovators, and leaders in the field of urology, sharing useful information with the general public to improve their lives and increase their overall health. A very warm welcome to the show, Dr. Garrett Pohlman. How are you today, Dr. Garrett?
Doing very well, and thank you so much for having me on today. It's my pleasure.
Oh no, it's my pleasure. So let's get this started. For some unknown reason, the listeners want to know, where are you right now on planet Earth? What are you doing? Where are you?
Well, I am currently practicing as a urologist in the U.S. Our practice is located in the state of Nebraska. For your listeners in Ireland that don't know where that is, if you look at a map of the U.S., you'll see Nebraska, which is in the center of the country. In fact, the city where I practice is located exactly between Boston and San Francisco. Nebraska is also known as the beef state. Agriculture is the number one industry in Nebraska, and cattle production represents the largest segment of the industry. And I actually grew up on a registered Angus farm in northeast Nebraska.
So we have this fascination in Ireland or Europe with the weather. So what's it like at the moment? What's the weather like in Nebraska? Are we hot, cold?
Well, for the beginning of December, it is unusually warm here right now. No snow on the ground, it's sunny, and our highs this week have been in the mid-60 degrees Fahrenheit with lows in the 30s.
Oh, that's very pleasant. Well, we'll crack on then. And generally our topic of discussion today is prostate health. But can you tell our listeners a little bit about your background and what motivated you to focus on prostate health?
You bet. So every man has a prostate, and many will ultimately be inflicted with benign enlargement of the prostate that can really affect their quality of life with bothersome symptoms, or they can be affected with a diagnosis of prostate cancer. So since finishing my urology residency training in 2013, I've already treated over 5,000 men with various prostate conditions. However, going through my practice caring for men, I began realizing that there was never enough time to give patients every bit of information they needed and wanted. I felt like there was just so much more in terms of education that I wanted to get into patients' hands. I felt like there was so much more I could do to empower men and their loved ones to give them the information they could use and apply to their own lives. So ultimately, I created the Prostate Health Podcast. And as well, I'm also currently working on preparing to launch a Prostate Health Academy.
Oh, wow. And when does that hope to launch? When is the plan to get that up and running?
Well, it's still in the works, but and with the working full time as a physician doesn't allow for a lot of extra time to put that together. But we continue to make steps. We're hoping for the new year in 2021 to launch that. So we'll hope to get that out here soon.
That's brilliant. So then, can I ask you then, Dr. Garrett? So we hear, as you mentioned there, with regards to prostate. So where is it in the body, and like what is it? Is it like a little donut? Is it pea-shaped, or what is it?
That's a great question, and many men are not aware of the function or location of the prostate or the impact it can have on their lives. The prostate is a small walnut-sized gland, which is located below the bladder. The urethra, which is the tube that drains urine from the bladder, actually passes right through the prostate. And the prostate's primary function is to produce the majority of the fluid for the male ejaculate, which helps nourish and transport sperm.
Wow. Okay. And it's as you said yourself, it's a walnut shaped. I mean, why then does it cause so many problems or issues? I mean, this little walnut, or why does it cause so many problems or issues?
Yeah. In terms of, you would think that such a small gland, how could it cause so many issues? But it really can. And as the prostate enlarges with age, it can start to press on the urethra and ultimately cause blockage of the urine flow from the bladder. And we call that enlargement of the prostate, or BPH, benign prostatic hyperplasia.
And can we do anything? I mean, you mentioned it with regards with age, but I mean, firstly, we can kind of cover what's the average age that you can have prostate troubles. I mean, is it men in their 50s or 60s, or is it much younger than that?
Yeah, it actually increases with age, and it kind of depends on whether we're talking about just the benign enlargement of the prostate, which that begins early on, but many men once they get into their 50s and 60s start having symptoms of an enlarged prostate. There's also inflammation or prostatitis, which can be a inflammatory response within the prostate, sometimes caused by infection, and that can actually occur in men, much younger, even in their 20s to 40s. So,
And can we do anything as younger men to kind of prevent these problems happening later on? I mean, can you take supplements, or is it just a case of it's just one of those things that it more than likely is going to happen?
yeah, that's a good question too. And there actually have been many studies done looking at supplements in terms of prevention of prostate disease. And unfortunately, at this point, we don't have a magic pill. And so you're correct with with age, these problems can occur, and that's why it's important to be aware of them. Because and then we kind of get into some of the what signs and symptoms to watch for. And so as that prostate begins to block the urethra, it can really cause bothersome urinary symptoms. Some of the more common symptoms include frequent need to urinate both day and night, weak or slow urinary stream, a sense that you can't completely empty your bladder, difficulty or delay in starting urination, and also having the urgent need to urinate and dribbling at the end of urination. And we also had mentioned the prostatitis, where again, could be inflammation of the prostate gland. This is another condition. Some of the symptoms that men should watch for include pain with urination. Other symptoms men may see include pain in the pelvic area, groin, genitals, their back, at times flu-like symptoms, but also sometimes just similar symptoms to enlargement of the prostate, including frequent urination, urgent need to urinate, and difficulty with urination. And then lastly, there's cancer of the prostate gland. Prostate cancer, there are usually no early symptoms, especially with early prostate cancer, which is why prostate cancer screening is really so important.
It's interesting you say that, because my own father, on a personal level, he's going through prostate cancer treatment at the moment, and I think he's doing radiotherapy at this present moment in time, and he was mentioned. The specialist was mentioning these things called nodules. Is it nodules? They're on the prostate, like little. Is that correct? Is it?
Correct. Yep. Nodules or firmness of the prostate.
And are they the cancer itself, or is it something that's kind of like a little, how do you say, a little wart or a pimple? Is that the way to probably explain it? Like what is these nodules, or what is on the prostate that kind of makes it be cancer?
Yeah. So when we talk about, we can kind of get into the prostate exam with that. And, this is called the digital rectal exam, or DRE, and for the test, the physician will use a lubricated and gloved finger with gentle insertion into the rectum. The test is brief, and while it may be uncomfortable, it's typically not painful. Now, this test is used to palpate changes in the prostate gland, including enlargement, irregularities in shape, and for any concerning nodules or firmness. And so not every man with prostate cancer will have these nodules or firmness on exam, but they can. And as that prostate cancer starts to grow and enlarge, it can kind of start to protrude from that prostate to the point where we can sometimes feel it, on the exam. Just one of the components that we use for prostate cancer screening, we also use the PSA. PSA stands for prostate specific antigen. Now, this is a protein produced by the prostate. Small amounts can be released into the bloodstream. Now, one way to think of the PSA is a man's check engine light. When the PSA is elevated, it's time to get checked out and make sure that there's nothing there that you need to worry about. The PSA is specific to the prostate, but not entirely specific to any one thing within the prostate. So things like enlargement of the prostate, prostatitis, but also prostate cancer can account for a rise in that PSA. So we utilize both the digital rectal exam to feel for potential nodules and the PSA for prostate cancer screening. While there may be some limitations of the rectal exam, it is still included as part of prostate cancer screening because, again, it may find cancer in men who have actually a normal PSA level.
And is there any specific, I mean, say, for example, your urinary flow is normal and you seem pretty healthy. I mean, is there any recommendation that, irrelevant of maybe having those symptoms, that you still get your PSA level checked? Would you recommend like men over 40 or 50?
Correct. So backing up a bit, just for some context, I think it's good to know that, prostate cancer is quite common. 1 in 9 men will be diagnosed with prostate cancer during his lifetime. It is the
Wow.
it is the most frequently diagnosed solid cancer in U.S. men, and the second leading cause of cancer death, just behind lung cancer. So with early detection, we are saving lives. Detecting prostate cancer at an early stage offers the best hope, with a 5-year survival rate at nearly 100%. Now that drops to 28% if it spreads to other parts of the body, which is why, again, prostate cancer screening and early detection is so important. As we talked about, as men age, having more, chances of being affected by prostate conditions, prostate cancer is more likely to develop in older men and in African American men. About 6 out of every 10 cases of prostate cancer are diagnosed in men who are 65 years of age or older, and it is rare in men under 40 years old. So the average age at diagnosis is around 66 years old. But prostate cancer screening should be taken, after a risk and benefit discussion between your physician. As far as when to start, you mentioned, it really depends on which guidelines you use. I personally like what are called the NCCN guidelines, or National Comprehensive Cancer Network guidelines, which recommends early prostate cancer detection at age 45, and starting at age 40 years old if you're African American or have a history of germline or genetic mutations such as the BRCA1 and 2 mutations. So, and then we talk about the diagnosis of prostate cancer. This can only be made with a prostate biopsy, which may contain samples of a dozen areas in the prostate and sometimes more. And typically it's sampled using a transrectal ultrasound guidance. And the current NCCN guidelines suggest if you have a PSA level of 3 or above, as far as having that discussion about a potential biopsy or further evaluation.
I mean, was it transrectal biopsy? Is that what it's called?
Correct. There's different ways to do the biopsy. There's a transperineal ultrasound guided biopsy. The most common one currently utilized is a transrectal ultrasound probe. So much like the rectal exam, that's how we get to the prostate to do the biopsy. Kind of a small ultrasound probe is inserted just right inside the rectum, where we can then visualize the prostate. We inject a little bit of numbing medicine around the prostate to make the biopsies more comfortable, and then typically take about, on average, 6 biopsy samples on each side, so 12 total samples. Now, we also are beginning to utilize MRI to also look for lesions within the prostate, which could potentially be targeted, in addition to the systematic general biopsies that we use. So I think we are looking more and more at utilizing MRI, especially for men that have already had a negative biopsy, but also now potentially using that more in men initially for their initial biopsy.
And can the signs and symptoms of prostate cancer differ from other things, or are they kind of similar?
Yeah, that's a great question, because with prostate cancer, typically men do not have any symptoms, again, which is why prostate cancer screening is so important. Some men, as with the cancer already advanced, where it's potentially spread to other parts of their body, some men can present with bone pain, blood in their urine, or weight loss. But typically, early on, the prostate cancer usually does not have any symptoms.
And can diet, I know we didn't touch on this previously, but can diet be a factor of getting prostate cancer? I mean, sugar and glucose, too much of that. Is there any scientific proof around that suggestion?
When we talk about, potentially, prostate cancer prevention, I think is, maybe a little bit about what you're getting at. There at this point, there is no proven prostate cancer prevention strategy, but you might be able to reduce your risk of prostate cancer by making healthy choices, such as exercising and eating a healthy diet. What we say is, what is healthy for the heart is healthy for the prostate. So, I think, low-fat diet, increase the amount of fruits and vegetables you eat on a daily basis, exercise, and maintain a healthy weight can all be good things. There are also, what we consider risk factors associated with a higher risk of developing prostate cancer, not just age, but we do know that with age, the risk of prostate cancer increases rapidly in men over 50 years of age. In fact, 60% of all cases of prostate cancer are diagnosed in men over 65 years of age. Also race. So prostate cancer occurs more frequently in African American men and Caribbean men of African descent compared to men of other races. Also geography. So prostate cancer is more common in North America, Northwestern Europe, Australia, and Caribbean islands compared to other regions. The differences in risk may be partially explained by the availability of more intensive screening programs and lifestyle differences. We look at family history. The risk of prostate cancer is higher in men with affected relatives, suggesting that prostate cancer has a heritable component. The risk of developing prostate cancer more than doubles for men with an affected brother or father. However, most cases of prostate cancer are in men without a family history. And lastly, we talk about, two more things. One is inherited gene changes. So there are several gene changes that appear to raise prostate cancer risk, but likely account for just a small percentage of cases. This is kind of where we get into talking about these mutations that I mentioned earlier, the BRCA1 and 2 genes, which has the function of helping repair damage to DNA. And then lastly, other risk factors. So that's kind of the BRCA is more of a germline mutation, but then we talk about somatic mutations. That's where we kind of get into diet, obesity, and smoking, and potentially as a risk factor.
Can you live without your prostate? I mean, and if you can, what would you expect with the man's works down there when you go to the toilet afterwards, and what would be possible, or is there possible issues that you might have with no prostate or removal of a prostate?
And that's a great question. The short answer is yes, you can live without a prostate gland. Now, one of the questions I sometimes get from men after they learn about some of the various things that can go wrong with the prostate, or they are having issues with the prostate, can't you just remove my prostate?
Yeah.
And the answer to that is that we only completely remove the prostate gland, or what we call, again, radical prostatectomy, in the setting of prostate cancer, and not for benign enlargement or prostatitis. Because they are definitely potential side effects to consider when you remove the entire prostate gland, including potential effects on urinary control and sexual function. And with prostate cancer treatment, unfortunately, there's typically no free lunch when it comes to prostate cancer treatment, because we can potentially affect quality of life issues. With surgery, when you remove the prostate, it's possible that you can affect the sphincter mechanism that holds the urine in place when you cough or sneeze or lift something. And so after removing the prostate, men can have some leakage with activity. Typically that does get better with time, and the success rates in regaining that control are close to 90% at 1 year out, where men are just down to no pads at all, or just one pad a day for some occasional leakage. The other quality of life measure that we can affect are the nerves that control men's sexual function to have erections. And so those nerves are basically stuck to the capsule of that prostate. And so in some men who have kind of lower to intermediate risk prostate cancer, in some situations where just some limited high risk prostate cancer, they may be candidates for what we call a nerve sparing prostatectomy, where we can actually gently leave those nerves within you, kind of peeling them off of that prostate capsule. But even in doing that, sometimes those nerves are bruised and stretched, and it can sometimes take some time to recover that function. And the same goes with radiation therapy for prostate cancer. It can affect the men's urinary control, oftentimes more overactivity and urgency, where they can't make it to the bathroom on time. But it also can affect the nerves too that control that sexual function. So,
with the treatments themselves, when you're going through the therapies, as you mentioned, I mean, is it specific to the individual what treatments they get, or is it a standard kind of across the board? Because, I mean, will you get chemotherapy, including radiotherapy, or is it just depending on how much the prostate will be affected? And then if you do get this therapy, how would you be feeling? Would you be feeling like kind of tired? Or I know you mentioned some of the symptoms there, but are you generally kind of sluggish? Do you feel sick or nauseous, or is it depending again on the individual?
Where men are first diagnosed with prostate cancer, and we're talking about prostate cancer that has not spread beyond the prostate, have several treatment options. So really, it depends on their risk stratification. There's different things that go into that, including a man's PSA level at the time of diagnosis, their overall Gleason score, which is kind of an indicator of maybe how aggressive the prostate cancer is. But in general, the kind of the main treatment options for localized prostate cancer include active surveillance, which means that you are not pulling the trigger yet on treatment unless needed, with the advantage of potentially avoiding or delaying the side effects of the various treatments. Then there's surgery. Again, we talked about the radical prostatectomy, which involves removal of the prostate gland, the seminal vesicles, which are glands behind the prostate, as well as removing some of the surrounding lymph node tissue. And lastly, radiation therapy, which utilizes ionizing radiation or photons to kill the cancer cells. How radiation works is it damages the cancer cell's DNA. And so, again, surgery and radiation are the two most common treatment options. Again, with radiation therapy, sometimes an additional treatment option will be added in with the radiation depending on the man's risk stratification, especially for men with more higher risk prostate cancer that are getting radiation. Also, we'll get what we call hormonal therapy. And this is called androgen deprivation therapy that lowers a man's testosterone level. And so it's been found that combining this hormonal therapy and the radiation together allows the radiation to work better. Now, we don't typically use the hormonal therapy in addition to along with the surgery. So it's typically just with the radiation for certain candidates. As far as other treatment options you might hear out there, there's also cryotherapy, which involves killing the cancer cells by a freezing process, as well as high intensity focused ultrasound using heat to destroy the cells. But again, the most common three are, again, active surveillance, prostatectomy or surgery, and radiation. Now, we did mention the hormonal therapy. So there's also men that, unfortunately present or are found to have cancer outside of the prostate. And so it's no longer confined to the prostate, spread outside the gland. We call this advanced prostate cancer. Now, for these men, the mainstay of treatment involves hormonal therapy, again, called androgen deprivation therapy. So this is not chemotherapy. Again, one of the major breakthroughs in the treatment for advanced prostate cancer was by Charles Huggins in 1938. And he discovered hormonal treatment for prostate cancer and was ultimately awarded the Nobel Prize for his work in 1966. Again, he discovered that if the production of male sex hormones or testosterone is prevented through castration, the cancer could be suppressed. Now, we're not curing the man's prostate cancer, we're suppressing it. How this is done currently is through medication, where we're able to suppress a man's testosterone to very, very low levels, and it also then suppresses the prostate cancer activity. So again, that's more for typically used for advanced prostate cancer, but also, as we mentioned, it's sometimes in combination with radiation therapy. Sometimes it's used to help shrink the prostate down prior to what we call brachytherapy, or putting radioactive seeds within the prostate. That's another form of radiation treatment for the prostate.
And can we bring back a little bit? You mentioned there previously prostatitis and an enlarged prostate. If you were not to get treatment for, say, prostatitis or an enlarged prostate, say you're a young man, I mean, would you expect it probably to go away eventually, or would you need like a course of antibiotics in a non-cancerous situation?
With benign enlargement of the prostate, it's typically not just going to go away on its own. Unfortunately, as that prostate continues to enlarge, it's going to continue to cause issues. The problem with that, and one way I kind of explain it to men, is there are two muscles in your body that you really don't want working against a blockage, and the one is your heart, but also your bladder. So if that bladder is having to work harder to push the urine out, it's going to start to affect your bladder health. And we start to see damage within the bladder. So we look in the bladder with the telescope, and we see this from time to time, where there's already kind of fibrous bands, or what we call trabeculations, forming throughout that bladder. This is irreversible damage. Small diverticula, or what we call sometimes cellules, little outpouchings of that bladder wall starting to form. You don't want to wait too long if you're starting to have these bothersome symptoms. If we can fix the problem early on, we can prevent this damage from happening. And we can do a whole episode on the treatment for an enlarged prostate, but I think we're now starting to see a shift in the paradigm of how we're treating an enlarged prostate, where back in the 80s when medications first came out, our alternatives or to fix the problem were more invasive. And so of course men just wanted to take medication and avoid treatment. or to fix the problem. But in a sense, we're kind of just kicking the can down the road with medication. There's potential side effects with medications, but we're not fixing the problem. And, I don't think we're really preventing the damage from occurring just by taking a medication. Now with prostatitis, or that inflammation of that prostate, that can be a condition that can kind of come and go or flare up from time to time. In some men, unfortunately, can be more of a chronic condition. And so, but there are some, again, it's still important just to kind of not ignore it and make sure that you go in and get evaluated by your physician to make sure we're not missing something more concerning.
I mean, some of the listeners might get uncomfortable with my next question, and it's an interesting one, especially with friends or colleagues of mine, where they would kind of, because men were kind of a little bit more, which would be kind of macho, kind of like signs and symptoms or issues. We kind of, as you mentioned, we kind of let it kind of grow a little bit before eventually we do get some help, advice. What about the question I was asked today from friends and colleagues in the aviation industry was on a men's side. If a man is experiencing painful ejaculations, is that the sign of a prostate issue or maybe an infection?
It certainly could be. That could certainly be a potential sign of, an infection within the urinary tract or within the prostate more specifically, or prostatitis. And so, again, if a man is having, ongoing pain, again, it's important to get checked out. I think we're just notorious for not wanting to see the doctor, and there actually can be definitely some overlap in symptoms caused by various medical conditions. And so, which is why Dr. Google or WebMD is not a substitute for going to your physician. Sometimes, like we said, waiting too long may result in negative outcomes in the case of the enlargement of the prostate, potentially these irreversible damage to the bladder if left untreated for a period of time. And for prostate cancer too, potentially missing a window of cure if prostate cancer is not diagnosed early on. So again, you definitely need a trained medical professional to evaluate the situation, determine the proper evaluation, assessment of your current situation, and potential treatment if needed.
Well, man, any men out there listening to this, get yourself checked out. There's actually, I don't know if you remember, Dr. Garrett, that there was a joke many moons ago, and it's got to do with the moon, where when the prostate was being checked, that people would sing Moon River when the doctor was to place his gloves on, the rubber glove treatment. And then when he goes to check the prostate, the patient would sing Moon River as a way of calming. Has it ever happened to you, no?
It also goes back to, I think it was a movie with Chevy Chase on it as well. And I think there was an episode where Chevy Chase did say the Moon River when he was getting his prostate. And I do have some patients that bring that up. And men's blood pressure can go up going into a urologist's office. We don't, a lot of times don't have men just lining up outside the door to get their prostate exam. And so I think sometimes, men like to utilize some humor to kind of get them through the moment. So
yes, the what we call, is it the white coat syndrome? Is that what you say in the US as well?
That's right. Yep. That blood pressure starts going up, and
yes. Anytime I go for medical, it's kind of interesting. My blood pressure is okay, and then I see the white coats, and it's like, ooh, time to kind of take deep breaths and get the blood pressure down. But I suppose, as you said yourself, it's kind of a normal reaction for us men. You're the host of Prostate Health Podcast, so what can our listeners expect from this podcast?
You bet. So the Prostate Health Podcast is really aimed at giving men the tools they need to be proactive about their health care. It's certainly no substitute for going to their physician, but I think it can really help men and their loved ones really take the initiative to maintain their health and be ready and educated to manage the problems that come along the way. With the Prostate Health Podcast, on a weekly basis, we're chatting with experts, innovators, and leaders in the field of urology, sharing useful information with the general public to improve their lives and increase their overall health. For those listeners that you have that want to learn more about prostate health, they can subscribe to the Prostate Health Podcast. This can be found on most major platforms, including iTunes and Spotify, and just subscribe there to make sure you don't miss an episode. Or you can also go directly to my website and listen into the episodes. We have show notes there and some helpful resources. The website for that is www.prostatehealthpodcast.com. Now, I also, hopefully as a treat for your listeners, what I've done is I've prepared a free mini webinar where I discuss my top 3 tips to promote a man's prostate health, but also longevity and quality of life. And to get to this this webinar, the address, and we can probably just include this in the show notes too, but it's www.prostatehealthpodcast.com/men's health. So again, for those listeners that are really serious about improving their prostate health, that is www.prostatehealthpodcast.com/men's health to join me for the webinar for my top 3 tips in promoting a man's prostate health.
Oh, we'll definitely put that link in. Can I ask you as well, are you on any other formats? Are you on Instagram and Twitter and LinkedIn?
Yeah, you bet. They can follow me on all those, pretty much all of those, Twitter, Instagram, and LinkedIn. You just, I know for Twitter and Instagram, it's at G Pohlman MD. That's at GPOHLMAN MD. We also have an active Prostate Health Podcast Facebook group, and they can find this at www.facebook.com/groups/Prostate Health Podcast, or just you can use the Facebook group search function and search for the Prostate Health Podcast and ask to join.
Well, on behalf of myself at AviationZorro, thank you so much for taking the time to chat with us today. You've educated me, and I'm sure you've educated our listeners as well. And as Dr. Garrett has mentioned, you can get in touch with him. He has a Prostate Health Podcast. We'll put the links in there with regards to how you can get in touch, and also information on the webinar. So thank you again, Dr. Garrett Pohlman, for chatting with me today on Aviation United by AviationZorro.
Yeah, well, thanks again for having me. It's definitely a pleasure.
My pleasure. Thank you.